Welcome to EASL Studio, our live broadcasting from the ILC 2022. My name is Thomas Berg and I'm the Secretary General of EASL. And it's a pleasure to welcome you, and what we want today here in the studio to give you kind of an overview what you can expect on the program from today. And it's a big pleasure to welcome my co-moderator, Professor Ulrich Beuers, who is the chair of the Educational Committee. Hi, Ulrich.
Thank you.
You're well? How was the day, the night?
Well.
Everything okay?
Short sleep. But
short sleep, as always. We are very busy, as you can imagine. Well, we have very distinguished guests here in the studio, and I first would like to welcome our good friend from the Latin American Hepatology Association. So we have with us Professor Manuel Mendizabal from ALE. So welcome. I hope you're well.
Thank you very much, Thomas. Thank you very much, Ulrich. It's a pleasure to be here. It's very important for ALE, for us, to be in your meeting. And I guess you hear this a lot, but it's very nice to be in person again. So visiting and talking again face-to-face with new friends. And personally, I really like the program and everything I've seen so far.
Thank you very much. Who else do we have? Ulrich?
Yeah, I have the pleasure to welcome Professor Krista Rombouts. She's working in London, but I have to add two more things. First, she's Belgian, working in London. Me, I'm German, working in Amsterdam. I think that's very nice to see that this interchange meanwhile is so normal that we work in other countries of the European Union or the UK. And she's also a valued member of the Educational Committee. So we meet every month to discuss new steps for the education. Welcome.
Thank you, Ulrich. And thank you for the invitation.
How did you enjoy so far the meeting?
It's a great meeting. And also today, EASL has set up a beautiful program.
Yeah.
As a basic scientist, it's a bit going between all kinds of different sessions. So, yeah.
We come to that later.
Yes.
And with our recommendations where to go. Thank you. Then Dr. Anna Saborowski, a real pleasure to see you.
Thank you.
And we know each other. You are a member of the Young Investigator Group, task force. How did you, from Hanover, you work in Hanover at this moment?
I do work in Hanover, yes.
Yeah, you were for a while in the US, also doing, I can say, important work, very good work. But let's focus on today. Last 2 days, did you enjoy it?
Oh, I did enjoy it a lot. I think, again, EASL is making it really hard to pick the sessions because they're just so amazing, parallel sessions. So I'm very, very glad for the on-demand option, which I will definitely use a lot also after the Congress.
Yeah. Mm-hmm. We come to today for today's program later on. Thomas.
Yeah, to learn a bit more what you might expect today, and what are your picks for today? What you're most looking for?
Well, today, as every day, it's a very attractive program. We have a lot of options, and as they just said, you cannot go to every session. But I have a small bias. I'm a transplant hepatologist, so there are three wonderful sessions, hot topics in liver transplantation. And when you look at the specific topics, they are like really challenging topics. We struggle every day, like multi-drug resistance in liver transplantation, downstaging, how far can we go, futility, when it's the transplant needed or when you just need to let the patient unfortunately go. So I believe that's very attractive, and that's the things we are discussing nowadays in liver transplantation. So the topics were very well selected in my opinion.
Yeah, you mean the multi-drug resistant bacteria before transplantation and how to cover this, or whether it could be already at a stage that it might be a contraindication, or?
Right, and I believe that every country, every center has its own problem. I mean, we cannot talk about the same bacteria here in London than down in Buenos Aires where I work. And we have, of course, different antibiotic pressure on our patients. So it is very important that ID transplant physicians be on top of these patients to select the correct antibiotic if they need it.
Yeah. Yeah. Anything else? What you're looking for?
Well, and I also am very interested in the viral hepatitis elimination topics that you have today. You have an abstract session, which is very interesting, and then later in the afternoon, you have a joint meeting with the WHO, where you cover not only Hep C, but Hep B and Hep D, and let me tell you that in South America or Latin America, that's a very important issue. We're really far behind to WHO goals, and especially after the pandemic. So we still need a lot of work to do, and hopefully we can get good ideas from these sessions.
Yeah, we really should not forget that having curative treatment does not mean that all people get the curative treatment. And in many countries, we still have the situation that the number being treated is quite similar or equal to the number of new infected people, right?
Correct,
Yeah.
correct. And then that's a very important problem you're bringing up. And we also need to go and diagnose those patients who are walking everywhere and they don't even know they have Hep B or Hep C. And that, I think, is the main barrier we are suffering in Latin America nowadays. Treatment access is not a huge problem, maybe in some countries, but mostly we can get access to the medication, but still we need to go and look for patients.
Yeah, yeah, many things. Yeah, well, Ulrich.
Thank you. Let's come to you, Krista. So far, for the last 2 days, one highlight which you want to mention before we come to today?
Yeah, I think there were a lot of abstract sessions that I went to, and they are simultaneously in parallel. So it was hopping in, hopping out. NAFLD, fibrosis, cancer, immunology, beautiful presentations of the basic science, the metabolism, liver diseases. So yeah, it was plentiful. And then the poster sessions, of course, as well.
Yeah.
Beautiful, yeah.
Where do you go today?
Well, as we previously, me and Anna, we were discussing a little bit, sometimes as a basic science, you need to go out of your comfort zone. And so I will be following NAFLD and the clinical aspects, but except the therapy, it's called. So it's just for me as a basic science to get updated a little bit, like, you know, the clinical aspects of NAFLD, what the doctors are working with for their patients.
And I have to say, I'm really happy that you say this, because we always want this link, you know, in our meetings, that the basic scientists do not stay alone, that they really learn what about, why it's important to learn more about the etiology.
I think it's an integral part of being a basic scientist, that we're here to investigate and to try to help to find a therapy. You know, so somewhere you need to get some balance, and that at EASL you can do that. You know, choosing clinical talks, and then you go to your own more comfort zone, you know, of the basic science, right? Or the experimental one. So I also picked out, today we have one of the abstract sessions will be the primary liver cancer. It's experimental, HCC, cholangiocarcinoma, and the mix of both of them. It's always good to see what has been improved, you know. And very important, I think, it's the state-of-art lecture. Yeah, it's the von Wilhelm Kupfer state-of-art lecture, basic science, and Guido Krumer is going to, you know, give us an update about autophagy in liver diseases. I think it's very important. Yeah.
We are very much honored that Dr. Krömer has the time to come here and to give us this lecture.
Indeed,
He's the top researcher.
Yeah. And also what I also like is going to the general session. We have it also today for the award, the ceremonies, because you do have these, you know, you see people like us, and in one way, you know, they get an award because they have been doing so much for the hepatology community. And I think it's a nice touch, you know, that you can give to the hepatology community. No.
Thank you very much for the moment. Anna. You already said what you enjoyed the last 2 days. We have almost no time to get everything or to get everywhere where we want. I have the same problem. I just came from a really brilliant symposium on PPC. Is PPC autoimmune or is it primarily secretory defect? Wonderful discussion and it's very good presentations. Where do you go today?
Well, today I have to say I will go together with Krista to the abstract session on liver cancer as an experimental, which I think will be great. And of course, I guess that the General Assembly is just a must go. And there's one specific talk that I'm very much looking forward to because I think the title is intriguing. It's called Microbial-Produced Ethanol and Underestimated Burden on the Liver. And I think this is a title it's hard to resist. So I will definitely be there and we're looking forward to that. And so my out of my comfort zone pick, because I'm usually more into hepatobiliary cancers, will be at 4 o'clock, actually chaired by Peter Fickert and Verena Keitel on novelties in the bile acid field. So it's probably more related to your world of science.
My interests, yeah.
Yeah. But of course, at the same time, there's also the takeaways from Baveno. And so this is also a tough choice, I guess, for many of us to make.
For the clinicians among us,
yes.
We have to go there also. Yeah. Thank you for the moment. Where do I go? I go to
because you mentioned the general session 2 starts at 1:30. I think there's also one study I'm very much interested in. These are the REEF studies, with the siRNA, the capsid inhibitors, showing 48 weeks of this finite treatment. This is also really a major breakthrough that we get now more these long-term data phase, well-controlled long-term studies in order to achieve cure. You mentioned it. Right. So I'm very much looking forward also to this presentation here.
Yes.
New evolving technologies in hepatology, it's really an expanding field.
Yeah. But I think we mentioned the state of the art. Autophagy, perhaps not all are really aware why it's so important, or?
I think it's not yet completely in our, let's say, brains, what role it plays, and we learn every day more about it, that it's central in the
could you
pathological
perhaps tell us what is really the important and why it changed our way of thinking about liver pathology?
Yeah, I think it's it's in the liver diseases, depending on the etiology, different cells are reacting, the autophagy is kicking in, or at one point is dysfunctional. So it's a way of how the cell wants to cope with the stresses that it senses. And really depending on the etiology, the causes it gets, different cell types will kick in a different system. If it becomes dysfunctional, then it just accumulates even more the stress for the liver. So I think it's very important to understand much better autophagy.
Good.
Last comment, 10 seconds?
Sure, of course, we have time.
Because I want to say abstracts. Everybody should go to the abstracts. This is so nice here now, this year, the opportunity to go to the abstracts, and I have reserved 2 hours for the abstracts, so we should all go there.
Yeah, for all of you attending only digitally, it's really a very nice hub in the EASL village where we present all the posters. I think a lot of space to interact. And also the different colors of EASL, where we have from basic science to liver cirrhosis, are represented there. Any final comment from your side? Something you want to mention to tell our audience?
Well, I just want to add that from Ale, we're very happy to be here. We really thank EASL's support. It's very nice to have our own stand here where everybody can pass by and talk to us. And you are all more than welcome to come to Buenos Aires to our meeting next September. And we have a lot of work to do. I mean, it's a huge continent that we need to be present, and we are trying to be bigger and stronger every year, and we are working hard from there, and we're learning a lot from you, from our sister societies. So thank you very much.
No, we are very grateful that you are here, and one of a a topic, a motto of this year's EASL's ILC is really uniting European hepatology, but together with our major sister societies globally, like you, Ale. So great that you are here. So I think with it we can conclude this morning studio. I just want to give you really perhaps again this brief overview on what we touched on. So the abstract session starts at 10, where we have the NAFLD with the clinical aspects, the ACLF story, viral hepatitis elimination, primary liver cancer, you mentioned experimental liver immunology and rare liver diseases. Don't miss the state-of-the-art lecture on autophagy from Professor Guido Krömer at 11:30. And we have symposia I want to mention because they are joint symposia, EASL with Cersei. These are the interventional radiologists, where we discuss, systemic and local regional treatment in HCC, and the one you mentioned, EASL together with ECDC, WHO, on viral hepatitis elimination and what we need to do. And of course, at 1:30, we have the general session too. So thanks to all our studio guests. Thanks to you, Ulrich.
Thank you.
A great day. See you later and see you in the evening for the evening studio. Bye-bye.
Bye.